Hi, you guys. Welcome back for our daily practice questions. As always, I like to get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner and I am the founder and CEO of the Nursing Studio. I provide resources, review courses, review videos, review books, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Y'all know I always like to get into my disclaimer and reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any other questions that you see here, I have designed and created based on the current guidelines being tested on the ANTC as well as AAMP exam. Now, any of the videos that you may see where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a patient presents to the office with complaints of pain, stiffness, and achiness to her knees and elbows. She states that when she wakes in the morning, the pain is intense and it takes some time to find relief. She notes some improvement after getting up and active for the day. Based on the patient's presentation alone, what is the best differential diagnosis at this time? Is it A, osteoarthritis, B, rheumatoid arthritis, C, psoriatic arthritis, or D, osteoporosis? Take a moment and tell me what you got in the comments, you guys. All right, so I always recommend reading the stem of the question first because it allows you to ensure that you are answering what is even being asked. Instead of reading these long scenarios and creating your own storyline, start from the question itself, the stem, to see exactly what they're asking, what they're looking for. So then when you start to read the full scenario, you can pick the pieces that you truly need to answer this, right? So here the stem of the question states, based on the patient's presentation alone, what is the best differential diagnosis at this time? And you know what I always tell y'all, if they're asking for a diagnosis, you need to run it back and see what the assessment findings are. So this patient came in, she's complaining of pain, stiffness, achiness to her knees and elbows. She states that when she wakes up in the morning, the pain is intense and it takes some time for her to find relief. And she notes that there is improvement once she gets active in the day. Now, when you're thinking of these things, pain, stiffness, achiness in those major joints, we start to think of forms of arthritis. And then, I tell y'all, with things that present similarly, I like y'all to figure out ways to differentiate the two because one, when you get in practice, that's going to be the determining factor of things that you need to do for your differential diagnoses. On boards, if they present similarly, y'all best believe they're going to try to give you things and scenarios like that to be sure that you're able to differentiate those common diagnoses that you'll see. So in this situation, then you need to be able to determine what type of arthritis so that you know how to treat adequately and effectively. So this patient states that the pain is intense in the mornings, but she does find some improvement after she begins to get active. This should lead you to B, rheumatoid arthritis. And I find a lot of my review students get hung up or mixed up with osteoarthritis versus rheumatoid arthritis. Remember, osteoarthritis is degenerative joint disease. The joint has wear and tear, and that's what's causing this issue, right? Of the osteo, breathing bone, right? Bone and joint region. So with that, they have they have more pain when active. They have more relief at rest. Whereas with rheumatoid arthritis, with that increased inflammation of those major joints, they have more stiffness when they are not active, when they are inactive. So when they rest at night, they have been still for, we'll say 8 hours. So when they get up in the morning, they're going to have that pain. But once they begin, and it's only a brief period of pain because once they get up and moving, they find relief. Whereas with osteoarthritis, when they get up in the morning, they have longer periods of pain. Okay. So again, here, that key was that she has that intense pain in the morning, but she finds relief once she starts to get up and active. B, rheumatoid arthritis. All right, question number two. The nurse practitioner has rheumatoid arthritis as a differential diagnosis. What is the best gold standard diagnostic testing to confirm this diagnosis? Is it A, a physical assessment, B, radiographic imaging, C, labs, or D, there isn't a gold standard diagnostic test. You need to refer to rheumatology. Take a moment and tell me what you got in the comments. All right, so here, the question is, what is the best gold standard diagnostic testing to confirm this diagnosis? So what diagnosis are we trying to confirm? The nurse practitioner is trying to confirm a diagnosis of rheumatoid arthritis. She has this as a differential diagnosis, so you need to know your next steps to confirm this. And when you're doing these things, make sure, I always tell y'all to study assessment, diagnosis, evaluation, and treatment. Work your way through this with all of your conditions and diagnoses so that you can ensure that you have enough information that if you are presented with this type of patient, you can work your way through, you can document adequately, but also on boards that any way these questions are provided to you, you're able to pivot. That's my structure of teaching and how I work through. So if you do it in my courses, that's what we do. But when you do this, that diagnostic part that I'm telling y'all to study, you need to know your differentials. But I always tell y'all, know those gold standard diagnostic exams. Because yes, we do physical assessments. Yes, we do lab work for patients with rheumatoid. But the gold standards are your radiographic imaging, your x-rays, your MRIs, your ultrasounds. Those are the things that's going to confirm those diagnoses. So when they say gold standard, that's what you're looking for. Don't fall for the things that you're just thinking of. Oh yeah, I know I do this, this, and this. Know those gold standards. Know those first line therapies. Okay, so B, radiographic imaging is your gold standard for rheumatoid arthritis. And then lastly, question number 3 for today. The nurse practitioner has confirmed a diagnosis of rheumatoid arthritis. What is the best treatment? Is it A, ibuprofen, B, methotrexate, C, prednisone, or D, Tylenol? Take a moment and tell me what you got in the comments, you guys. All right, so the question is, what is the best treatment? And y'all know what I tell you. If they're asking about a treatment, you need to run it back and see if they have provided you with a diagnosis. If they have not provided you with a diagnosis, take this as a diagnosis question and run it back a step further and look for the assessment findings, because you have to determine what it is to be able to determine how to treat. So here they have provided the diagnosis, and it's rheumatoid arthritis. So how do we treat? What is your best treatment? What is your first line therapy? We know with rheumatoid arthritis, our first line therapy are DMARDs. B, methotrexate is a DMARD. Yes, you can use ibuprofen, but that's typically in conjunction to. We start with DMARDs as a monotherapy. If you need to start doing additional therapies and adding on combo medications, then we proceed with things of that nature with your steroids and your NSAIDs, okay? But first line therapy is B, methotrexate. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But make sure to meet me back here. If you need any of the resources that I offer, feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number 1 at gmail.com. The things that I do offer are my review book. You can get it in an ebook or paperback option. They're both linked in the bio of this channel. It is designed for family and adult gero, preparing for the ANCC as well as AANP. It is broken down by systems. There are interactive sections per system to test your knowledge in that format that I teach in: assessment, diagnosis, evaluation, and treatment. There's also images to help you tie everything together, charts. I'm big on visualization and helping you break it down, seeing it in words, seeing it with images to apply it, and then testing your knowledge. And then lastly, there are practice questions with rationales at the end. Also, if you prefer to study on the go independently, I have a self-paced review course designed for family and adult gero also. It's also linked in the bio of this channel. Our 5-week group intensive review, it starts September the 9th. That is also linked in the description here. We're only doing 10. Y'all know I like to keep small classes because what we do with our 5-week group review, I have a structured study plan. You have assignments Monday through Friday that you're able to complete at your own leisure. We do live practice questions, but you know how you take a class and you feel like you've completed everything, but you want to gauge where you are individually. So that last week of class is for an individual assessment. So once you have submitted all of your assignments throughout the 5 weeks, and we have worked as a group throughout the 5 weeks, we've done our live practice questions. On that individualized week, I assess your strengths and weaknesses. We have a session so that I'm able to help you make sure that you're on the right track and prepare to pass boards. So if you're looking for that 5-week intensive review, again, that's linked in the description of this video. And this is our last one for this year. And then lastly, our one-on-one sessions. One-on-one, I always say reach out to us as it is customized, engaged specifically for you. So let's make sure that you are utilizing the appropriate one for your needs, because they're offered in 3 different tiers. You can book sessions for weaknesses, so 1 to 2 weaknesses per session. You can book an exam readiness assessment to see if you are prepared to test right now, or if there's some areas you need to hone in on before going before boards. And then lastly is the custom one-on-one session, where you're provided with a pretest to gauge where your strengths and weaknesses are based on the time that you're looking to allot to the exam. I structure a study plan for you, work alongside with you during that time to take you to a successful exam attempt. So if you are looking for any of those resources, feel free to reach out to the nursing studio. But y'all know what to do. Make sure you meet me back here. Happy studying. Bye, y'all.